Hello, hello. Happy Tuesday. We are, we're right there between 12 and 12:15. This is Dr. Miriam, and here at Innate Healthcare Institute, we are doing our Tuesday lives. I keep saying I have to have some sort of like name for this. We'll call them just Tuesday lives. I'm excited for today. So anybody that shows up, if you have questions, let us know. In the meantime, we are going to get our nurse, Miss Becca, to come in.
Hello, Nurse Becca.
So we have Nurse Becca, and we have our Nurse Jack, and then we have our amazing Angela as well, who are part of our staff that help make everything work very smoothly. So Angela is on our orthopedic chronic disease side. Any of you who have come in here have met her if you're on that side. And then Jack kind of floats in between. We'll get Jack on here next time. And then Becca is with us in autism. So she works with Dr. Ashley and I. And we just thought it would be a good idea to have you go through.
To explain what a visit will look like for you guys, because I know a lot of people have a lot of anxiety coming into the treatment. So if we can kind of explain what it will look like, it always usually looks the same. It might help you guys coming into your visit. So the first person you'll check in with is Nick. He is at our front desk. He's great. Once you check in, he will let me know when you guys are ready. It is very important on your first visit to show up 30 minutes early.
Please.
Because you have a big consent form to fill out.
Yeah.
Payment takes a while. It just helps things run a little smoother. Like at the end of the day, we are a doctor's office. So if we get off time, it trickles into every one of our appointments.
Yeah.
But once you check in with Nick, he'll let me know. I'll take you guys back. We'll get a quick weight on the kiddo, and then I will room you. I will go over what your visit will look like for you. I'll go over the next 3 days. Any quick questions you have, I will answer anything for you guys. I'm the one that will be going over testing, how to collect, what testing you're getting, what you paid for to confirm between Nicholas and I, what you paid for, get you up to date on that. I'll go over the routes. So if it's your first day on Dr. Miriam's schedule, you will be getting an intramuscular injection, intranasal. I'll talk about setting you up with some CBD or L-theanine for tomorrow's visit, which is the IV day. Any questions you have on that, we can answer as well. And then I let you know if you're talking to CC today or the next day, because it depends on which schedule you're on for the doctors. I need to know that. You don't need to know that. I will tell you when you come in.
Cece's our behavior specialist. If you remember us talking about her previously, she's the one that will do not only talk to you about the specific things that you're working on with your kiddo, but also she'll do a survey, which we look at objectively. Where is your kiddo starting out? And it's just a metric for us to track each visit. It's like we track it 1 month, 3 months, and then every 3 months from there on for 2 total years.
So important. Yeah. If you're listening to this, you get sent the insights. It's called insights. You get sent that survey.
What's the other name for it that they see? There's a different name.
Benchmark insights. You get sent through an email to fill out that survey before you come. And very helpful. Yeah, 1 week prior is very helpful if you fill that out for Cece. So we have a baseline. She will go over it with you, though. We won't leave you stranded. She'll go over it with you, and that way she can track your kiddo's individual progress, which is really awesome to go back and look at things that you maybe missed. It's in the data that you can see. Then on top of that, she'll go over specific behavioral, stimming, communication, the things that your family as a unit wants to target. She's a great resource to help you guys target that.
Yes.
Then once she leaves, the doctor will come in and chat with you. Doctor will go over any last questions. After the doctor is done, then we will come in and do treatment. So the treatment itself, which everyone has anxiety for, is only like 5 minutes, if that.
Yeah,
If you're 3 to 5 minutes treatment. Most of your appointment time is talking, discussing with CC, me, and the doctors alike. Treatment itself is always at the end of the appointment, and it's only 3 to 5 minutes, super quick.
Yeah. And then we can talk about, we often get asked about sedation. We have nitrous in the office. It is, as I've mentioned before, it is a risk versus benefit. And typically the risks just aren't there sufficiently for us to say that would be the benefit, would be to do nitrous. Because keep in mind with nitrous, we still have to hold your kid down and put a mask on them and hold them with a mask until it works. But it's at that point where it's like...
And move them to a room across the clinic. They're in a scarier room because they have to go in the procedure room to get the nitrous.
Yeah.
So it ends up almost being more traumatizing giving the nitrous than just when we hold them down. Again, it's so quick. We have extra hands. We do it all day long. We are not scared of your kiddos. Hell, we do it all, and we're here to help. You guys can help them to help you hold.
Yeah.
We never ever have had to like not complete a treatment.
Right.
We're always able to successfully do a treatment.
Right.
Whether it takes a little longer and we need extra staff to come in and help hold, well, we've never not been able to complete a treatment.
Yeah, we just worked with a kiddo who is upwards of about 250 pounds. And we just had extra staff. And so, like I said, we're just used to it. So a lot of parents will just say, well, my kid isn't going to sit still. And my kid, nobody wants it.
No kiddo.
No kiddo can sit still.
We really do. Yeah, the kid that's like, okay. But in most cases, our reality is that no kid wants to be here. No kid is going to chill. And it's scary. It's okay that it's scary for them. We're here to help the process along.
Yeah, and I would say one of the things that I would highly recommend, depending on your kid and depending on the communication you have with them, is not to tell them that they're not going to get a shot, that they're not going to get they're going to be upset knowing they have to get the shot, but at least they know what's coming. I think the biggest part, and we see this on repeat visits, once they know what's happening, so it's the unknown that's scary. So telling them from the get-go, hey, you're not gonna get a shot, and then they walk in the office and they're getting a shot, I think is more problematic for the kiddo than when you come in and say, hey, we're gonna get one poke here, you're gonna get a spray in your nose. They might still not like it, they might fuss, but they know what's coming. Versus telling them, no shot, you're not getting anything. And then they come in the office and all of a sudden we're coming at them with a shot.
And they're betrayed. They feel betrayed. Yes. Then like in our experience, it takes those kiddos a lot longer to calm down after.
Yes.
Because your kiddo's they're not going to be happy about getting a shot. But if you prepare them, you don't need to prepare them months in advance. That sometimes can give like extra anxiety.
Yeah.
Like a couple days before you come, you can prepare them. You can show them our faces so they know what we look like, because we're who they're going to see.
Yeah.
And you can kind of prepare them on how you're going to check in, you're going to get a weight, you're going to go in the room, you're going to chat with the staff, and then when they come in, they'll do a quick little pinch, quick little nose spray, count to 10, and then it's over.
We're done. Yeah, having a 6-year-old myself, I know that a lot of that preemptive, like, this is what's going to happen, going through the steps multiple times is very helpful. It is that giving them the awareness of this is what's going to happen versus just coming in and them having no idea that it even though it could upset them, they're going to have it done, it can also calm them because they know what to expect. So just some thoughts there on, kids seem to get over a lot faster when they actually know and they're upset, but they're like, okay, fine. This is what they said we're going to do.
We have a lot of kiddos, they will be like, after they get it done, they're like, oh, that wasn't that bad. And that a lot of kiddos be like, oh, that's it. Or like even the parents be like, oh, that's it. That was so fast. It's like, it's the anticipation leading into it. The actual treatment itself, we don't want you to have anxiety going into it. It's actually the anticipation and the waiting before is worse than the actual treatment itself.
Yeah. So we're trying a new, my desktop here. So I don't see the comments the same way I do on. We don't know if we're getting. I don't actually know if I'm getting comments. So I see a couple people that are viewing. If you guys have, if you want to put down, this is kind of what I always do. If you want to put down where you're tuning in from, and if you have any questions for us, we'd love to answer them. They don't have to be autism specific. We can answer other clinic questions as well. We're just better with the autism specific.
That's what we do all day.
We do all day long. But I am planning on having, I know I had talked about last week having Dr. Hazel on today, and she is with a patient currently. So we can, we work through schedules and just the next time we can get her on, we'll get her on. And we have a new doc, Dr. DeLuigi, who is our orthopedic specialist. And so we will get him on as well. I tried for today, and he had some consultations.
We'll get Jack on. We'll get Cece on. Yeah. Maybe we can have Angela, so that way you guys can all meet us virtually before you
put
come.
A face to the name of who's going to be working with you. So I think that pretty much that's kind of what we want to do is just introduce Becca. See, she will also take care of testing. She does a lot of communication with families after you leave the office.
Scheduling, follow-ups, any medical questions you can come to me about. Me and Dr. Miriam work hand in hand all day together, so we'll get them answered for you. But yeah, you'll have my email for any like medical testing. Is this normal? Any question you have are available.
Yeah.
For your guys, any of your questions.
And before we go, I do want to say, hello, Chandler.
Ooh, Chandler.
You're very close. Well, thank you. Awesome. And I do want to say that we do have exciting news that we have updated our integrative care add-on for anybody that's been with us before. We have updated our plan now to moving forward. Today forward, we are going to be including frat tests in our integrative care add-on packages for anybody moving forward. It has been something that, if you remember the previous videos where I talked about the frat tests, the folate. Basically, we're looking for folic acid for any autoantibodies that are being created by the body that are keeping the brain from being able to use folic acid. Not that the brain doesn't have it, it's that it can't use what's there because there's antibodies blocking or binding the receptor sites of the cells in the brain. And then that leads to cognitive function delays, it leads to behavior challenges, and it leads to speech challenges. And so that is... Since we started doing that within the last couple months and seeing research says 60 to 70% of kids with autism are positive, we are seeing at least that, if not more.
If not like 80%.
Yeah,
like our kiddos are positive.
It's high. And so in doing that more consistently, I really was wanting to get it to a place where this was just something we automatically did for anybody that's getting, any of the testing packages. So it's still an add-on for anybody that's not getting the integrative care add-on, the extra testing. But if you get the 1.2 billion plan, it is included in that. But I'm super excited to say that we now have that bundled in there. And it can also be an add-on. But we have seen some really cool results with families. I still give leucovorin, or that reduced folinic acid, for both positive and negative kiddos. The dosing is different, and then there's no diet change if they're negative. So, but what we've seen is pretty amazing for outcomes. Just from that alone, but combined with the stem cell, then we've seen so many more outcomes. So
it's an extra piece of the puzzle.
It's an extra piece of the puzzle. Physiologically, what are we missing if we're not doing that? So that will be coming moving forward. We've got a question. Hi, Alexandra. New to the facility and program. Do we guide much after the treatment? So yeah, we're gonna keep bugging you for a long time. We do 1 week follow-ins, and then 1 month, and then 3 months. So we follow
6 months, 9 months, a year.
Yeah, we continue to follow for quite some time. Even after your last visit, we continue to follow with you. So, it's helpful because a lot of times, as you're going through the process, and we're doing cells with each kiddo, questions come up as far as behaviors and changes and things they're experiencing. And so that's where Cece is fantastic at helping parents guide through that, because it's not just about giving stem cells and pushing you out the door. The behavior part is super important. The testing, the toxin parts is super important. All of it really is what makes and gives the greatest outcomes. So we will continue to follow with you. We will continue to follow up. And if you have questions, you can always reach out to us.
Yeah, and no kids protocol or experience will be the same. It's pretty different based on kid to kid to kid. We know that, so it's not like a one size fits all. So we're always here too. Cece will follow up with you at those times. If you have questions between that, you can always ask us some, because it's different. Kids will experience different things. So if you're noticing an increase in hyperactivity, or your kid has a lack of appetite, any questions like that, which we see all the time, you're more than welcome to reach out to us, and we're open to help you through whatever your kid is experiencing, because it might not be the same as another kid.
Absolutely. Every experience is so different, for sure. So thank you, Alexandra. I hope that answered your question. Let us know if you want to follow up with anything else after that. Gil, hello. How are you? Thank you for coming on to our live. Anybody else have any questions right now? Because if not, we'll go ahead and call it a day. Yes. Yeah, please do. I forgot that. So if you're watching a replay, post #replay in the comments. Leave a question if you have some questions. We'd be happy to answer anything that came up. So either in the comment section for the video, you can also email at info@innatehealthcare.org. In that email, you can send a question, or in the Facebook Messenger, you can send a question and we will answer it next.
We clearly love talking about it. So any questions?
All right, let's see. Will we have advice for things that we should be doing after to complement the stem cells, or should we keep working with someone else? We've seen a naturopath and frequency
practitioner in the past.
In the past,
She'll know about stem cells.
yeah. Or how to complement them well. Well, yeah, so yeah, I think that's just part of it, right? So when we say that we typically recommend 4 visits to our office, more is almost a minimum just to get the outcomes that you're looking for, hopefully, right? We never guarantee an outcome. But for most families, 4 tends to be the place that they're starting to get more and more outcomes. They kind of add up slowly over time to be greater changes. And so in that time frame, we definitely talk to you about different ways. If we're doing the testing, we're doing supplementation, and then we're repeating testing, or we're continuing supplement protocols. So we definitely work with you to say, how we can, whether it's diet. CC also is really good at helping parents in the diet area, where it looks like a lot of our kiddos are very, very picky eaters. CC works with the stem cells themselves open their desire to want to try to eat different foods. We hear that all the time, but sometimes it just takes kids trying new foods to actually get adapted to wanting to try new foods. And so CC is really good at working with expanding picky eaters. So yeah, there's lifestyle things that I think just really fall a lot under more the behavioral section, and then also our the testing that we're doing and keeping up with that. So that tends to be a whole package look at each kiddo. So yeah, we definitely
I think because they're working with a naturopath already, we have a lot of our kids that work with different doctors. Dr. Miriam is really great. Like if your doctor has a question, or if they're wondering, or like prescription wise, or like balancing, you can tell us what that naturopath has already prescribed you. We'll want to know that. But you totally can keep any other doctor.
Absolutely.
You have going into it. If you have more questions, so it's not like we give you the stem cells and then kick you out and we're like, good luck. Like we will work with you. Like she's saying, diet, we can work with you with testing. You're going to work with CC. So it's like a whole, I don't know, like circle of things.
Yeah.
We give you in order, and that's how we honestly see the best results is when our patients come in and they're compliant and they work with CC, they do what she is recommending, they do the testing, they do the detox, they do the retesting. Like that is when we see
the best outcomes.
Yes.
And I will say, as a baseline, when you were saying that, is one of the biggest things I tell parents you can already start your kid on this, whether you're working with another naturopath or you're not. Hands down, the nutrient status of each kid is super important. So if we don't have, especially when you consider the picky eaters, if we don't have proper nutritional status, meaning they're not getting good fruits and vegetables, even our fruits and vegetables today are so depleted because the soil is depleted of the nutrients compared to, 50 years ago. So having good minerals and vitamins on board, ANRC is my preferred. We are not associated with them. We have no affiliation. The researcher who created the ANRC, it's Autism Nutrition Research Center, www.autismnrc.org. They have a vitamin called Essential Powder Plus or Essential Capsule. I don't know if it's plus, but they have a capsule version and a powder version. That is a multi-nutrient and multi-mineral supplement. So it is a really good supplement made for kids with autism that is methylated vitamins. It has L-carnitine, it has glutathione, like really, really good. I highly recommend that for every single parent, even when I'm doing my consultations when they haven't come to see us, as a baseline. Because keep in mind, nutrient status is going to be what helps naturally detox the body, what helps naturally the cells function. If they're missing nutrients, they're not going to function as well. So that is one that you could all start, like go buy their product. Like they're great. I mean, there's some other ones too. I think Spectrum has one too. I just like this one a lot. And ASU, Arizona State University, is actually doing research using his products, they're doing a gut microbiome test for autism specifically. So there is a link and correlation to even like what he's created and what they're using. So that is something that, I don't know, just people ask us all the time, what kind of nutrients would you recommend? That is one that I would highly recommend. And I'm going to do a little tip here. Never take it with water. It's disgusting. It's a B vitamin. It smells like a B vitamin. If you ever smell B vitamin, they're just weird. They're very metallic smelling and tasting. So always a milk or milk alternative and or juice. Those are my 2 biggest ones. I've taken it because I give it to my daughter. She is neurotypical, but it's a sound supplement for anybody, but especially formulated for kids with autism because there's no fillers, there's nothing in there. So I have tried it. So just note to self,
It's nasty.
But it's good. It's great for them. And 2 weeks. If they're fighting you on it, give it 2 weeks. Give them like a quarter of the dose and just be consistent. Any parent out there understands who has the greatest will win out. And so it's a game of wills. It takes about 2 weeks. Just keep being consistent. Eventually the kid will understand you are going to keep giving it to him, so they'll just be like, fine. And I say, a little bit of liquid, pull it in a syringe, give it to him, follow with something else. Don't put it in a big cup and especially expect them to finish it. Totally an aside, but Gil, you are coming to see us in April. Super exciting. You are excited, yeah? Too excited to meet you. Awesome. Corinne, how many months apart in between treatments? I usually say on average 6. So our hard stop is 3. You cannot, like, we like to give 3 months minimum for the cells to work in the body. Anything after is fine. I say 6 months because that just tends to give or take. So it can be like 4, it can be like 8. Some families can only come once a year. It just depends on what your availability is, what our availability is, and as to when we can get you in. But as long as over 3 months, we're fine after that. Some parents can only come once a year. It does not negatively affect outcomes to only come once a year. But
there's no right or wrong answer.
yes.
Minimum 3 months. When you can get in after that,
yes.
It's okay. I know there's like a lot of information out there. Even on our website, we used to have 3 to 6 months. People used to take that as law. It's okay. Anytime after 3 months, and you come in, it's fine.
Yeah, but good question. Yeah, thank you. All right. Well, thank you everybody for your questions. And hopefully we answered it. And if you have more, let us know in the comments. Let us know via email, info@innatehealthcare.org. You're very welcome, Corinne. And we'll see you next Tuesday. All right, bye.